Okay, so now we are done with our transabdominal exam and we saw pretty good, but like we can see the endometrium very well. The doctor really wanted us to get a closer look. We're going to do a transvaginal ultrasound. So this is the portion that where the probe goes in the vagina a little ways. So for this, we definitely need to do patient instructions since it's a little invasive. It might be something that needs to be explained a little bit more than transabdominal. You'll want to prep the probe. We have probe covers that we put on the probe for, sterilization. The exam technique, basically how we're going to do the exam. We'll kind of talk about that, scan orientations, scanning planes, scan techniques, scan protocol. Translabial, I don't do those very much at all, but I have had to do it in the past. And disinfecting technique, because obviously we want to disinfect the probe afterwards. Okay, so this is what the transvaginal looks like. So it's just a little bit different of an orientation than a transabdominal ultrasound because you're kind of looking like the patient is laying on their head. If you look at this is going to be anterior, so the bladder is going to handy dandy red pin again. The bladder is going to be like over here. So this is going to be like more like anterior. This is like by bowel with the rectum over on this posterior side. Caudal is going to be this way. So this is towards the feet. And this is cranial. So it's just a little bit different of an orientation. This is the anterior portion of the uterus, and this is the posterior portion of the uterus. When we turn the probe, we're going to turn the probe towards us, a 90-degree angle, and that's going to give us our coronal or transverse view. A lot of people just say transverse, but technically it's a coronal view, and it's kind of going to be the same images as we would get transversely in the uterus, but just a closer look. So our scanning planes, the sagittal view, which I'll show you in class, is basically the indicator is going to be on top. You'll be inserting the probe and looking that way. And when you go like this, and when I want to turn transversely, I'm going to turn towards my thumb like that. If we are wanting to look more at the fundus, we are going, if this is an antebird uterus, so you're scanning like that, and you want to look more at the fundus, you're going to look up like this. And if we're want to look more at the cervix, we're going to raise the probe up like this. So it's going to be opposite of what you think. Again, the probe is rotated from a 90 degrees to get the transverse or coronal images. But look how better a picture that is. So much closer, so much a better image than what we could get transabdominally. And this is why I really do prefer to do these transvaginal ultrasounds. Because if I'm going to be doing it, I want to make sure that I'm getting the best and potentially can help diagnose what's going on. And sometimes with transabdominals, I just don't feel like they're as diagnostic. They are good for a good global view, but they're definitely not as close of a view. So this is our midline uterus. You would measure same thing, just closer here to here. That's the fundus to the cervix. And from anterior to posterior. You're also going to measure the endometrium here, which is this thickness. So that's a pretty thick uterus or endometrium. So the patient probably is about to start their period. Then we're going to do the same kind of protocol as we did with the transabdominal. We're going to go to the left. We're going to go to right and kind of sweep through the uterus, and then we're going to rotate the probe 90 degrees to look at a transverse uterus. And we will measure there. So it's like the width. There's another really good one. This white looking thing right here, this is the endometrium. And then this is the width of the uterus again. Yep, they measured it for me. So that's a good measurement. You'll scan through the uterus the same way. You'll go from the cervix to the inferior uterus. So there's the cervix, the inferior uterus to the mid, and then up to the fundus. Look at these ovaries. These are such good ovaries. You can see them so well this way, a closer look. You can see here that they're measuring the length and the width. This right here, this is a dominant follicle, like the one that we talked about last chapter. If it's less than 3 centimeters, it's not considered a cyst, it's considered a follicle, which we'll talk about more later. This is the left one. Just an easier view, really easy to visualize. Kind of what I just talked about there. Oh, okay, this is interesting. So this is a retroverted uterus. So you can see that this is like the anterior portion, but the uterus is tilting back towards the posterior portion. This is what we call the retroverted uterus. Let me show you. That's an anteverted. You can see that the fundus of the uterus right here is anterior. And the fundus of the uterus here is posterior. So you can see the difference, they're flipped. This is a retroverted uterus. Easy still, really difficult to see transabdominally, really easy to see transvaginally still, just flipped a different way. Beautiful transvaginal. Again, transvaginal. So for ovaries, sometimes they can be a little bit difficult because, like you said, sometimes the ovarian ligaments can get stretched out and they can be in different spots and are not exactly bilaterally close to the uterus. So a good way is to follow the fundus of the uterus to the coronua and kind of follow the broad ligament to the ovary. You'll learn about that in your clinical site. Sometimes it takes a little bit. If you've gone to the iliac vein and artery, then you've gone too far. The ovary is not going to lay outside of that. Coronal, same thing, transverse. You're going to rotate your probe from here 90 degrees. Get a transverse. So I think that's our what we're going to do for this one here.